Hello everyone, my name is Holly Johnson and this is my PowerPoint over radiation therapy. What is radiation therapy? Radiation therapy is a type of cancer treatment that uses beams of intense energy such as X-rays, gamma rays, electron beams, or protons to kill cancer cells. It most often uses X-rays, but protons or other types of energy can also be used. And it also most often refers to, but is not limited to, external beam radiation. We'll talk more about the different types of radiation therapy later on in the slide. The need for radiation therapy. More than half of all people with cancer receive radiation therapy as a part of their cancer treatment. Doctors use radiation therapy to treat many types of cancer. Radiation therapy is also useful in treating some non-cancerous, also known as benign, tumors. How radiation therapy is used in people with cancer. The doctor may suggest radiation therapy as an option at different times during the patient's cancer treatment and for different reasons, including as the only primary treatment for cancer, before surgery to shrink a cancerous tumor, also known as neoadjuvant therapy, after surgery to stop the growth of any remaining cancer cells, known as adjuvant therapy, in combination with other treatments such as chemotherapy to destroy cancer cells, and in advanced cancer to alleviate symptoms caused by the cancer. There are three different types of machines that radiation therapy are given through. There's the linear accelerator, cyclotron, and synchrotrons. The type of machine used depends on the type of radiation therapy the doctor chooses to treat the cancer. The first machine we're going to discuss is a linear accelerator. A linear accelerator, also known as a LINAC, customizes high-energy X-rays or electrons to conform to a tumor shape and destroy cancer cells while sparing surrounding normal tissue. It features several built-in safety measures to ensure that it will not deliver a higher dose than prescribed and is routinely checked by a medical physicist to ensure it is working properly. A linear accelerator is most commonly used for external beam radiation treatments for patients with cancer. It's used to treat all parts and organs of the body. It delivers high-energy X-rays or electrons to the region of the patient's tumor. These treatments can be designed in such a way that they destroy the cancer cells while sparing the surrounding normal tissue. And LINAC is used to treat all body sites using conventional techniques: intensity modulated radiation therapy, volumetric modulated arc therapy, image-guided radiation therapy, stereotactic radiosurgery, and stereotactic body radiotherapy. Our next machine is a cyclotron. Cyclotrons accelerate particles along an outward spiral path and are held in the path by a static electromagnetic field perpendicular to the spiral path. A cyclotron is most commonly used in proton beam radiation therapy, seeing how this is where the protons are made. Over 1,200 cyclotrons are used in nuclear medicine worldwide for the production of radionuclides. Synchrotrons. They also can be used in proton beam radiation therapy because these two, just like a cyclotron, produce protons. They are like cyclotrons and are cyclic accelerators and send particles into a closed loop path, increasing their speed with each revolution. Who administers radiation therapy treatments? Radiation oncologist, a radiation physicist, a dosimetrist, a radiation therapist or a radiation therapy technologist, and a radiation therapy nurse. How is radiation therapy given? Radiation therapy can be given in three different ways: external radiation or external beam radiation, internal radiation, and systemic radiation. The type of radiation one might get depends on the kind of cancer they have and where it is. In some cases, more than one type is used. And as we go on in this PowerPoint, we will discuss each type of radiation therapy. Okay, let's start with external beam radiation. External radiation or external beam radiation is the most common type of radiation therapy used for cancer treatment. A machine, also known as a LINAC, is used to aim high-energy rays or beams from outside the body into the tumor. Most people get external radiation therapy over many weeks. It's done during outpatient visits to a hospital or treatment center. There are many different types of external beam radiation. Three-dimensional conformal radiation therapy, known as 3D CRT, intensity modulated radiation therapy, IMRT, image-guided radiation therapy, IGRT, helical tomotherapy, proton beam radiation therapy, intraoperative radiation therapy, and stereotactic radiosurgery. The first we're going to start with is three-dimensional conformal radiation therapy, also known as 3D CRT. It delivers radiation beams from different directions designed to match the shape of the tumor. This helps to reduce radiation damage to normal tissues and better kill the cancer by focusing the radiation dose on the tumor. The next is intensity modulated radiation therapy, IMRT. It's like 3D CRT, but it also changes the strength of some of the beams in certain areas. This gives stronger doses to certain parts of the tumor and helps lessen damage to nearby normal body tissues. And over here in this image, you can see how they have compared 3D CRT to IMRT. Next is image-guided radiation therapy, IGRT. It is a form of 3D CRT where imaging scans like a CT scan are done before each treatment. This allows the radiation oncologist to adjust the position of the patient or refocus the radiation as needed to hit the tumor and limit other damage. Computed tomography, magnetic resonance imaging, ultrasound, and X-ray imaging may be used for IGRT by visualizing bony or soft tissue anatomy. Other methods for IGRT use markers placed on the patient's body surface or implanted within the patient's body. Helical tomotherapy. A form of IMRT delivers radiation inside a large donut. For this treatment, you lie on a table that slowly slides through the donut as the machine spirals around you, as demonstrated in this image to the right. It delivers many small beams of radiation at the tumor from different angles around the body. This may allow for even more precisely focused radiation. Proton beam radiation therapy uses proton beams instead of photons or electrons. Protons are parts of atoms that cause little damage to tissues they pass through, but are very good at killing cells at the end of their path. This means that proton beam radiation may be able to deliver more radiation to the tumor while reducing side effects on normal tissues. Protons can only be put out by a special machine called a cyclotron or a synchrotron, which we discussed earlier in the PowerPoint. Down here in this image that I have for you, it's a demonstration showing the way X-rays and proton beams affect the tumors. As you can see on the left, the X-rays go straight through the tumors, and then over on the right you can see the proton stops at the tumor, focusing all of its energy there and not going through. Next we have intraoperative radiation therapy, IORT. It is an external radiation given directly to the tumor or tumors during surgery. It may be used if the tumors can't be removed completely or if there's a high risk the cancer will come back in the same area. While you are asleep, the surgeon moves the normal tissues away from the tumor and protects them with special shields. This lets the doctors give one large dose of radiation to the cancer and limit the effects on nearby tissues. IORT is given in a special operating room that has radiation shielding walls. As you can see in this image that I have, the very first step is the intrabeam is delivered during the lumpectomy procedure immediately following tumor removal. In step 2, after the surgeon has removed the tumor, the radiation oncologist positions the intrabeam applicator in the area of the breast where the tumor was located. In step 3, the lower energy radiation is delivered locally to the targeted tissue in the tumor bed, minimizing healthy tissue exposure to radiation. And lastly, in step 4, after 20 to 30 minutes of radiotherapy, the applicator is removed and the surgeon then closes the incision. Next, we have stereotactic radiosurgery. It isn't really a surgery, but a type of radiation treatment that gives a large dose of radiation to a small tumor area, usually in one session. It's used for brain tumors and other tumors inside the head. In some cases, a head frame or shell may be used to help keep the patient's head still when using stereotactic radiosurgery. Once the exact location of the tumor is known from brain scans, radiation is sent to the area from many different angles. The radiation is very precisely aimed to affect nearby tissues as little as possible. The next type of radiation therapy we're going to talk about is internal radiation, obviously different from external beam radiation therapy. Internal radiation therapy, also known as brachytherapy, allows a higher dose of radiation in a smaller area than might be possible with external radiation treatment. It uses a radiation source that's usually sealed in a small holder called an implant. Different types of implants may be called pellets, seeds, ribbons, wires, needles, capsules, balloons, or tubes. No matter which type of implant is used, it is placed in your body, very close to or inside the tumor. This way the radiation harms as few normal cells as possible. Here, as you can see, there are two different types of internal radiation that can be given. The image on the left is intracavitary brachytherapy. It is the radioactive source is placed in a body cavity, such as the rectum or the uterus. Intracavitary therapy is indicated primarily for superficial lesions, and the patient's tumor must be purely or predominantly monocystic to receive intracavitary brachytherapy. It is indicated in patients with solitary cysts, for patients harboring recurrent cysts after previous treatments, and in patients experiencing clinical deterioration from the cystic portion of their tumors. It is often used after therapies have been exacted. Over on the right, in this picture, it is showing interstitial radiation. In this picture that we have here on the screen for you, it is showing how the implants are being implanted into the prostate gland for cancer treatment. With interstitial radiation, it's different from intracavitary brachytherapy because the intracavitary, the implants are implanted in a cavity, where the interstitial radiation implants are implanted in or near the tumor, but not in a body cavity. How are implants placed? The implant procedure is usually done in a hospital operating room designed to keep the radiation inside the room. One or more implants is put into the body cavity or tissue with an applicator, usually a metal tube or plastic tube called a catheter, under anesthesia, general or local, whichever the doctor sees fit. Imaging tests, an X-ray, ultrasound, MRI, or CT scan are usually used during the procedure to find the exact place the implant needs to go. Before being placed, implants are kept in containers that hold the radiation inside so it can't affect others. How long do these implants stay in place? The length of time an implant is left in place depends on the type of brachytherapy you are getting. High dose rate brachytherapy. If you're receiving this, it allows a person to be treated for only a few minutes at a time with powerful radioactive source that's put in the applicator. The source is removed after several minutes. This may be repeated over the course of a few days to weeks, and the radioactive material is not left in your body. The applicator might be left in place between treatments, or it might be put in before each treatment. If you're receiving low dose rate brachytherapy, in this approach, the implant gives off lower doses of radiation over a longer period of time. Some implants are left in from 1 to a few days and then removed. You'll probably have to stay in the hospital, sometimes in a special room during this treatment, since you are receiving radiation. And for larger implants, you might have to stay in a bed and lie still to keep it from moving. Some implants are permanent, while others are taken out after a few minutes or days, as just discussed. And the type of implant you will get depends on the type of cancer and where it is in your body, your general health, and the other treatments you have had. Okay, so in this image, this is just showing everything that can be treated with internal radiation therapy, whether that be the low dose rate or the high dose rate. Our next type of radiation that can be received is systemic radiation. Radioactive drugs, called radiopharmaceuticals, are used to treat certain types of cancers systemically. A radiopharmaceutical is a liquid drug made up of radioactive substance. Examples of radiopharmaceuticals used for systemic radiation include radioactive iodine, strontium, samarium, and radium. Over here in this image to the right, it's just showing the difference between intravenous radiation therapy, which is systemic radiation, and machine radiation, which would be external beam radiation. With systemic radiation, these drugs can be given by mouth or put into a vein. They can travel throughout the body. You may need to be in the hospital for 1 or 2 days while getting this treatment. It is sometimes bound to a special antibody called a monoclonal antibody that attaches to the cancer cells. Keeping others safe after having systemic radiation therapy. Because systemic radiation therapy uses an unsealed radioactive substance that goes through the patient's whole body, some radiation will be in the body for a few days until it's had a chance to get rid of it. The patient might be told to follow these steps for a certain amount of time. Flush the toilet twice after each use and wash your hands well after using the toilet. Use separate utensils and towels. Laundry may need to be washed separately. Drink extra fluids to flush the radioactive material out of your body. No kissing or sexual contact, often for at least a week. Keep distance of 1 arm's length between yourself and any others who spend more than 2 hours next to you in a 24-hour period. You may need to sleep alone for a week or so. And limit your contact with infants, children, and women who are pregnant. And also limit contacts with your pets. Risk with using radiation therapy. Radiation therapy side effects depend on which part of your body is being exposed to radiation and how much radiation is used. The patient may experience no side effects or may experience several. Most side effects are temporary and can be controlled and generally disappear over a time once treatment has ended. And in rare circumstances, a new cancer, second primary cancer that's different from the first one treated with radiation, may develop years later. Here we have the different side effects for the different parts of the body being treated. With any part of your body being treated by radiation therapy, you could experience hair loss at treatment site, which is sometimes permanent, skin irritation at the treatment site, and fatigue. If you're having cancer treated in your head or neck, you may experience dry mouth, thickened saliva, difficulty swallowing, sore throat, changes in the way food tastes, nausea, mouth sores, tooth decay. If you're having cancer treated that's in your chest, you may experience difficulty swallowing, cough, shortness of breath. If you're having cancer treated in your abdomen, you could experience nausea, vomiting, diarrhea. And if you're having cancer treated in your pelvis, you could experience diarrhea, bladder irritation, frequent urination, sexual dysfunction. Okay, so what have we learned? We've learned radiation therapy is used as a part of a patient's cancer treatment. We've learned also used in treating benign tumors and not just cancerous tumors. Radiation therapy is given 3 different ways. External beam radiation is the most common form of radiation therapy. Internal radiation is the most invasive, seeing how there are implants placed in the body. And systemic radiation involves injecting radiopharmaceutical into the patient's systems in order to treat the cancer. And last but not least, there are risks with receiving radiation therapy, but the good outweighs the bad. Thank you for watching my PowerPoint. I hope that you've learned something and I hope that you enjoyed it.